Hi, my name is Lindsay Espejel, and I am a member of the Healing Circles healthcare team and a nurse in Houston, Texas. I'd like to share with you a few applications of Healing Circles in healthcare that I've experienced. While Healing Circles started in cancer care for patients and their families, I have seen the power of Healing Circles for healthcare providers. Burnout is not new in our profession, and in the wake of the COVID-19 pandemic, we are seeing new levels of secondary trauma that providers are experiencing. I had one nurse share with me that she is going in on her days off to hold the hand of dying patients because their families can't be there. I had another nurse share, I've seen so much loss. I've never seen anything like this in my professional career, and I don't know how to cope. I'm isolated from my family because I work on a COVID unit, and I don't know where to go for support. It's heartbreaking to hear my colleagues and friends. Emerging research from the Journal of the American Medical Association from Shanafelt last year asked providers about what do you need to process this level of anxiety? And some of the responses were, hear me, support me, care for me. And that's what I'm hearing over and over again. And that's what I'm seeing Healing Circles provide. A space to be heard, a space to be supported, and a space to be cared for. Whether it is in everyday circles between two nurses on a floor, or at shift change huddle, nurses leaving their shift asking simple questions. What are you leaving behind today so that you don't carry it home with you? It's an important question to help process trauma. Or formal circles where providers and nurses are gathering together to share what's on their hearts. It can be held around specific events, such as a code, or an adverse event, or a patient death, where nurses gather together in a circle around a patient bed and hold a moment of silence to honor that patient and have an opportunity to share from their heart. And the response has been that it is so powerful to just have a space where they can be heard and known by their colleagues, that it's like medicine to their soul. And I believe for the highest quality of healthcare, providers need an opportunity, a space, and a framework to be able to share what they're carrying. And that's what I believe Healing Circles provides. I see it happening every day. A space, a framework to care for the people who care for people.